PRP is short for platelet-rich plasma. And this is a really cool technology that's being used all over the body. We particularly use it in the face and for hair restoration, but you'll hear about orthopedic surgeons injecting PRP into joints and fluid spaces, things like this. And basically the technology behind it is using your own proteins and growth factors and minerals and such, all from your own bloodstream to promote tissue growth.
Okay.
So for the case of PRP, we draw your blood in the office and spin it down in a centrifuge that separates it into kind of heavy and light stuff. The light stuff on top is kind of a honey-colored watery liquid called PRP, or platelet-rich plasma. We withdraw that and separate it out from the other product, like you might remember, like red blood cells, white blood cells, that heavy stuff is on the bottom. And then when we isolate for that particular individual, we can inject it all kinds of locations on the face, under eyes, jawline, temples.
So it's their own stuff going back in.
Absolutely, 100% their own stuff.
Wow.
And the theory is that the bloodstream does a great job of delivering these materials to the tissues, but wouldn't it be great if we could isolate them and hand deliver them? This is a needle procedure, and again, we use numbing agents, but kind of hand deliver them locally and concentrate into these regions to promote tissue growth.
Now, what's the process? Does somebody have to come in to have the stuff withdrawn and then come back on a later date?
Nope.
It all happens the same day?
It all happens the same day. Yep.
How long does it take? I mean, just from the time I walk in the door to...
Depends on the treatment, but about a half hour.
Wow. Geez, that quick, huh?
Yes.
And then is there any difference in terms of, some of the other procedures and fillers and all, there's, some swelling and pain? What's same here? Or
certainly any needle procedure can cause bruising, swelling, things like this. And so that's just something we discuss. But typically in the case of, like, for instance, hair loss, applying the treatment for hair loss, that's typically isolated to the scalp, and that's a little less noticeable. But if we're treating an area like the under eyes, we always tell people to plan on some puffiness and swelling because that's really a focal point.